Thank you very much, Lisa. And thanks for having me. I know it's getting late. Well, it's late for me, but maybe you guys are used to listening to talks at 8 p.m. Anyway, I hope we haven't lost you yet, and that you will get informed about the study that we're going to be running here on the Sunshine Coast. So as Lisa said, it's called Screening Participant and Health Service Impact of Population-Based Breast Density Notification in Australia, co-designed randomized controlled trial in Breast Screen Queensland. So as Lisa mentioned, I work in the School of Public Health at the University of Sydney, and my research focuses on cancer communication and decision making. And more recently, I've led a program of work looking at the impact of breast density notification here in Australia. And as Lisa also mentioned, my colleague and mentor, Professor Nemet Husami, is online today and will be available for questions. And she also works at the University of Sydney and is affiliated with the Daffodil Centre there. So I would just like to also acknowledge the traditional owners of the land on which we meet today, and also on which a lot of this work and where my office is at the University of Sydney. So first, I'm just going to begin with what is breast density. So breasts are made up of 3 different types of tissue: fatty tissue, fibrous tissue, and glandular tissue. Breasts are considered dense if they have relatively high amounts of fibrous and glandular tissue and relatively low amounts of fatty tissue. And we now know that breast density generally decreases as you age. So as you get older, your breasts become more fatty and less dense. So just the different types of tissue, the amount changes. Breast density also can only be seen on a mammogram image. So a woman or a GP or any type of doctor can't feel a woman's breasts and tell what their breast density is. It's only can be detected on a mammogram image. So there are 4 different categories of breast density as classified by the BI-RADS classification system. Category A is almost entirely fatty. Category B is scattered areas of fibroglandular density. Category C is heterogeneously dense, and category D is extremely dense. And your breasts are considered to have high breast density or be dense if you're in the upper 2 categories, so category C or D. So why is this important? Why is breast density important and something to know about? Well, breast density is one of a number of independent risk factors for breast cancer. So along with things like family history, obesity, physical inactivity, it's one of many different independent risk factors. An estimate suggests that around 30 to up to 50% of women in the general population, screening population, so women aged 40 to 74 years, have dense breasts. So they're in that upper 2 categories, C or D. And women with dense breasts are more likely to have a breast cancer missed on mammography. And this is due to the amounts of that fibroglandular tissue in the breast, and that appears white on mammography. And we also know that a breast tumor appears white. So it kind of creates this masking effect where it becomes harder for a radiologist to see a breast cancer on mammography if there's more of that dense tissue. So breast density cannot also easily be or readily be modified. So you can't tell a woman to, lose weight or eat a certain diet or do something to reduce their breast density. However, we now know that supplemental or additional screening, such as having an ultrasound or an MRI, are being recommended for women in these upper 2 categories of breast density. And the reason behind this is because using the supplemental screening might detect cancers that were hidden on breast tissue, so adding that extra modality might pick up and find more cancers, but there's also important harms to be aware of. And I'm going to go through a little bit about this in the next slide. So as I mentioned, supplemental screening can increase cancer detection and reduce interval cancer rates. So we know this now from a few different randomized controlled studies that were done overseas. And we also know that there hasn't been any randomized controlled trials, so that's the highest quality of evidence, with sufficient follow-up to show that the supplemental screening with ultrasound or MRI can save additional life in asymptomatic women with high breast density who have no other risk factors. So we know, we're not sure yet whether adding these additional modalities, such as ultrasound or MRI, will actually decrease mortality and improve long-term outcomes. We know it picks up more cancers. It has been shown now from good quality evidence, but we don't have trials that show long enough follow-up to see if that actually makes a clinical benefit to the women in the long term. However, there's been one modeling study of MRI screening projected that it could have an additional benefit for those women with extremely dense breasts. So the current clinical pathways for women with dense breasts, so women in those upper two categories, categories C and D, is for women to talk to their doctor or their GP. And this is what's being recommended in Western Australia, where women are notified about their breast density, and also in the United States and Canada. However, there's no uniform recommendations in any of those jurisdictions for GPs in relation to supplemental screening. So there's no clear guidelines on what then to do with women with dense breasts. Like I said, we know that there's this supplemental screening that might pick up additional cancers, but there's also additional harms that might come from those, including higher rates of false positive, the potential for overdiagnosis of cancers, and we don't know what the long-term outcomes in terms of the mortality benefit will be. So based on that, there hasn't been any really clear guidelines for clinicians to follow, and this makes it difficult to then tell women, well, you've got dense breasts, but where do we go from here? So in Europe now, extremely dense breasts, they put the European Society of Breast Imaging, I believe is what EUSOBI stands for, has recommended quite recently that women that extremely dense category, so category D, that's around 10% of women in the screening population, that they be screened additionally with MRI every 2 to 4 years. But that's the only real guideline that's out there at this time. And there's quite a bit of controversy around that for the reasons I stated before. And here in Australia, BreastScreen currently has no role in the supplemental screening process, and this is really due to that lack of evidence of the additional health benefit. And so because of all of this, there's been continued international debate surrounding the pros and cons of widespread breast density notification. And countries outside the US, including Australia, are now currently grappling with whether or not to inform women on a population-based level, so through programs like BreastScreen. As you can see here, this is some media and some high-impact publications internationally that has had some controversy around this issue. In 2020, the United States introduced federal legislation mandating breast density notification after almost a decade of advocacy. And this advocacy was really driven by industry, consumer advocacy groups demanding the right for women to be informed, and that concern about the burden of missed cancers. However, a very recent United States Preventative Task Force draft recommendation has stated that more research is needed on whether or not women with dense breasts should have additional screening, including ultrasound or MRI. And they've given that an I rating for anyone who's up with the United States Preventative Task Force guidelines, and that just means insufficient evidence. So although in the states they're notifying women across the states, that's federally legislated now, there's this recommendation that's been put out that we really don't know what for clinicians to now tell these women. So there's a whole population of women being told about their breast density, given a little bit of information on what it means, like I started my presentation with, but there is still no clear pathway for what women should do about that. So given the current evidence and debate, BreastScreen Australia's Standing Committee on Screening has recommended that until more evidence is available on how breast density is best assessed and managed, BreastScreen Australia should not routinely record breast density or provide supplemental testing for women with dense breasts. However, like I briefly mentioned before, for over 10 years, BreastScreen WA has had a policy of reporting breast density and notifying women with dense breasts. But the rest of Australia, Australian breast screening programs do not notify women. So a number of years ago, I started working on a body of work from a public health perspective in relation to breast density. And we started this work by conducting some systematic reviews, so collecting the evidence that was out there and synthesizing it to try and find out what it meant, what it means. And what we first started by conducting a systematic review on the impact breast density notification had on women and also then on primary care practitioners. And what we found was that important gaps in women and GPs' understanding of breast density exist. There's a psychological impact that exists for women, and how best to communicate this information to women is still not understood. There's also was a particular need for high quality evidence in this area because there had been none conducted. Even prior to the implementation of the federal legislation in the United States, there had only been cross-sectional survey studies and smaller studies done. There had been no randomized control trial to help inform that policy. We also conducted a systematic review on the impact of breast density notification on supplemental screening. And we found that the majority of studies demonstrated a significant increase in supplemental screening practice in those jurisdictions that notified women of breast density, which is pretty obvious or not too surprising. And there were a number of patient-level factors beyond breast density that were shown to be associated with the increase in supplemental screening, which included the family history of breast cancer and also race and socioeconomic status, with those in ethnic minority group or CALD backgrounds being able to access these screening services less. We also conducted some qualitative research here in Australia, which was funded by the Department of Health in 2020. And we conducted focus groups with women, and we found that there was very limited awareness and knowledge of breast density. There was a high interest in supplemental screening, and there were strong preferences for women being informed and educated further. We conducted a qualitative interview study with GPs across Australia, and we found that GPs have limited knowledge, little experience in talking about breast density and support and how best to talk about it, and that there were mixed views around notification at that time. However, there was high interest in further education, training, and support. We backed up that qualitative work with the GPs by conducting a quantitative survey and found that there is strong support for notifying patients of breast density across the board, and an interest in further education and training, which were somewhat similar to what we found in the qualitative work we published. And this all led to our most recent piece of work, which was an experimental randomized control trial. So we assessed women across Australia, the impact of notifying women, where we randomized them, some women to get notified and some women not. And this was a hypothetical notification. So they did this online. It wasn't women going through the screening service. So this acted almost as like a pilot to the study I'm going to talk about in a second. But we targeted women of breast screening age. So it was the population that would, in reality, be getting these notifications. And what we found through this randomized control trial was that more women were more informed and knowledgeable about breast density in the groups that were notified. However, there were important psychological outcomes that existed, including higher levels of anxiousness, confusion, and cancer worry. So as you can see there, approximately 50% of women that were notified in this study reported that they would be anxious, about 25% confused, even when given some explanation on what breast density is, and about 16% worried about the risk of cancer. We also found an impact on screening services. So there was an increased interest in getting mammographic screening between routine schedules, so around 25% of women in those notified group, and an increase in supplemental screening, around 15% of women in those notified groups. We also found an impact on primary care practitioners with an increase in interest in having breast density related appointments, and that was about 65% of the women in the notified group. So as you can see here, if you extrapolated this data across the Australian breast screening population, that would be quite a significant impact on women at their individual level, screening services, and also general practitioners. And so off the back of this, we have teamed up with Breast Screen Queensland and in particular the Sunshine Coast Service to run a trial here on the coast which was the title of our talk, that's looking at the screening participant and health service impact of population breast density notification. So the primary aims of our trial is to assess the effect of notifying Australian women participating in population-based breast cancer screening of their breast density on their psychological outcomes and their health service use. And the secondary aim is to determine whether different modes of communication, so giving them a hard copy letter versus giving them information and a video online, alter these effects. So to do this, we're going to be running a prospective 3-arm randomized control trial. And like I said before, this is the highest quality evidence that you can collect to help inform health decisions. And this has really been co-designed with Breast Screen Queensland and the Sunshine Coast Service in particular. So across these 3 arms, we'll have standard care in the first arm. So this is the standard mammography report letter. There'll be no notification of breast density. In arm 2, the women will be notified of their breast density, and it will include a hard copy health literacy sensitive information insert about what breast density is. And then the third one will be notification of breast density plus a link to an online written and video-based health literacy sensitive information. So the intervention arms will be arms 2 and 3, but they will differ in the mode of the communication that women receive. So here you can see a part of the standard Breast Screen Queensland Well Women letter that they get sent after they've been cleared and found no signs of breast cancer. So you can see there it says, no signs of breast cancer were found on your recent breast screen with us. And we've added in this blurb here for the women in arm 2 and 3, where it'll say, your breast screen also shows that your breasts are dense. This means you might have higher amounts of some tissues, of some types of breast tissue. Dense breasts are common. Dense breasts can make it harder for a doctor to see a breast cancer on a breast screen. X-rays are still the best way to test for breast cancer in most women with dense breasts. There is more information about breast density, or dense breasts, on the next page. So women in the control group will not get that blurb, but in the other 2 groups they will. And then this, I'm sorry, it's quite small, but this is what the additional information that they will receive. And this is all health literacy sensitive, so it's written at a low grade reading level. It's been consumer tested and advised with, and it just gives some kind of basic information like I did at the start of my presentation about what breast density is and what it means for them, and some pros and cons of supplemental screening. In that third arm, they'll get that information online, and then they'll also be directed to a link with a video that we've developed. It's about a 3.5 minute video saying exactly what's on the information sheet, but with animations and obviously a voiceover. Now, our sample is around 3,000 women who are going to be screened through the Sunshine Coast Breast Screen Queensland service with dense breasts. So only women who are identified in categories C and D will be included in the study and will be randomized. The other women in A and B won't be included, and their screen will be as their communication. Everyone's screen will be as normal, but their communication will be as normal. And we'll be running this across the 7 sites that Lisa mentioned before, and in the mobile van. And we're hoping that we can do this within 4 to 6 months to reach that sample of 3,000 women. So giving a conservative estimate of around 30% of the women screened will be dense. At the beginning, I said between 30 and 50%. We're going to go conservative and say around 30%. There'll probably be about 10,000 women that will be screened to reach our intended sample, who will need to consent in. Breast density will be measured at the time of the breast screen using fully automated software of Volpara, and there'll be no change to the breast screening process for any of the women. It'll just be the communication that they receive after that will be changed. So there will be some exclusions. So as I mentioned before, it'll only be women in categories C and D, so everyone in A and B will be excluded. There'll only be women here on the Sunshine Coast, so this is the only spot outside of WA that women will be told their breast density this year. Women who are recalled for assessment with screen-detected abnormalities will be excluded. Any woman who has a personal history of ductal carcinoma in situ or breast cancer will be excluded. Any women reporting a breast symptom, as you've just heard before, will be excluded, or if a radiographer records a clinical concern during screening. women who cannot consent to breast screening, women who require an interpreter at the time of booking and may not be able to consent for themselves, and who do not have a mobile phone, as that's how we will collect the data over a 2-year period. So we will be collecting women's information at baseline. This will be from the BreastScreen Queensland databases, so things like age, postcode, language, family history, etc. And then at 8 to 10 weeks after their breast screen, so they'll receive their letter around 4 to 6 weeks after their breast screen, and around 8 to 10 weeks we'll contact them and we'll assess their self-rated health, overall well-being, health literacy, and medical preferences. We'll also collect their primary outcomes at that time, psychological in terms of anxiety, health service use in terms of supplemental screening, and GP interaction. And at the 8 to 10 weeks, that will all be collected on an intention base. So obviously women won't have seen anyone at that time, but we'll collect their intentions to do so. And that at our other follow-up periods that I'll explain in a minute, we'll collect actually whether or not they went through and did that. And secondary outcomes along the way will include things like breast cancer worry, breast density knowledge, mammography use, and acceptability of breast density notification. So pre-breast screen, women will be sent a short message about 2 weeks prior informing them about the study with an SMS or link to the information about the study. The women will need to consent, so it's an opt-in consent, informed consent process. Women will then, only with dense breasts will be included, like I mentioned, and we're thinking around 30 to 35%. The interventions are the letters that we're going to be sending them with that additional information. And then the outcome measures, as I said, will be collected at 8 to 10 weeks, at 12 months, and then at 27 months. And we're going to be sending women a text message to collect this information, and it's all self-report online. And then alongside this, we'll be doing a bit of qualitative work where we'll be conducting semi-structured interviews with some of the women to gain more of an understanding about how they felt about this information, who they saw, what they did, and all that kind of stuff. So there's kind of a schematic of what the trial will look like. So step by step that I just took you through, women will attend breast screening, will get their baseline data from the BreastScreen Queensland database. If they have dense breasts, then we'll randomize them into one of those 3 arms. So standard screening mammography results, which will be the control, the notification of breast density plus the hard copy information, the notification of breast density plus the online and video information. And then we'll collect those outcomes as I just spoke about at 8 to 10 weeks, 1 year and 2 years. So we're also planning some additional sub-studies around the trial. One will be a qualitative focus group with culturally and linguistically diverse women, because not many hopefully, but some of these women will be excluded from the trial just because of consent purposes and data collection purposes. We'll also be conducting semi-structured interviews with local GPs. So hopefully some of you will be interested in taking part in that when the time comes. And this will be to explore and understand the views of breast density and if this trial and the notification of breast density has had any impact on the service. We'll also be conducting interviews with key stakeholders at BreastScreen Queensland and the Sunshine Coast service to understand different issues related to implementation and stability of notification, and doing an economic evaluation, so understanding the costs and outcomes of breast density notification in Australia from a healthcare system payer perspective. So as I mentioned before, this qualitative interview study we're planning to do around 1 year, and we will be recruiting local GPs in the area to help us with that study when the time comes. So please keep an eye out. So you might be wondering, I think Lisa touched on this a little bit, but you might be wondering what is really the significance of this trial. And this will be the first trial in Australia and the world to test the immediate and downstream impact of breast density notification prior to any implementation into systemic practice or legislation. So as I mentioned, in the US, there was no trial that helped inform this. And there is a lot of concerns now that, some women don't understand what this means. There's a gap in equity of women from different backgrounds and ethnicities, and it's impacted clinicians and screening services. So we're hoping that our trial will help map out some of these consequences to inform future pathways here in Australia and minimize any potential harm to women and extra burden on services. It'll also be a pilot for Breastscreen Queensland, should they decide to notify moving forward. And findings will help inform Breastscreen across Australia's current and future practice and policy on this quite controversial issue, and may also be relevant to screening programs in other countries. So what does this mean for GPs? So locally, you may get questions about the trial. What is it? Where is it? When is it happening? Who is eligible? How do I book a breast screen, and etc. Or you might get additional appointments related to breast density and have some additional questions. Now, we've developed an information sheet, which I will put a QR code up at the end of my talk, and it's also in the packs that are being handed out today at the back of the room for GPs that we've developed to help have these conversations around breast density and give you a bit more information and background and some resources to access. We'll also be sending those that information sheet alongside the reports to any GP who is nominated. So they'll get a copy of the women's breast screening letter, and then they'll get this information as well if the woman has dense breasts. Nationally, if breast density notification is implemented through the population-based screening program Breastscreen, there'll be more breast density-related questions and appointments. There may be uncertainty about recommendations and clinical pathways for women, and there are equity considerations in terms of supplemental screening and the pathway for women to take there. And then internationally, it will provide further evidence on the impact that this will have on GPs. Like I said, there hasn't been much work done on this internationally, and you know, there's a lot of people that are saying it hasn't been great or necessarily rolled out in the best way to help GPs and clinicians have these discussions and support them. And this may provide that kind of support in the development, education, and resources. So just in terms of what you may potentially advise your patient, given kind of the uncertainty around supplemental screening and the controversies around breast density and notification. Well, first of all, I think we can all acknowledge that conversations are complex. So as I said before, it's not only a risk factor for breast cancer, but it also has that masking effect. However, it does decrease with age, and there's a variability in the measurements. So we know that the measurement's not always perfect by radiologists or the software, so there is variability between measurements, and that can change over time because of the decrease as well in breast density as women age and go for their subsequent screens. Supplemental screening can be an option. However, like I said before, there's no evidence with sufficient follow-up to show additional lives are saved. We know it increases detection of cancers, including interval cancers. However, there is a higher rate of false positive, overdiagnosis. There's cost considerations for women and equity and access considerations. Currently, mammograms remain the only universal recommended screening test for all women in all density categories. And a shared decision-making approach about the benefits and harms recommended, including considerations of other risk factors such as family history, is really important. You can't just look at breast density alone. You have to take into consideration a holistic view on the woman and then kind of make an assessment on what may be best for her. So here are a few relevant national resources and links. So the first one's just Breastscreen Australia. So that's their breast density position statement, some of which I showed you at the beginning of the talk. And the other healthcare professional information that's been developed and is relatively balanced and good here in Australia is the Clinical Oncology Society of Australia's facts and issues on breast density. But like I said, in the information pack back there, I believe it's the second page, we've developed a local information sheet for healthcare professionals to have those conversations and provide some additional links and information. This is a QR code for anyone who might be interested to have that on file. And like I said, if your clients are part of the trial and they have you as a nominated GP, you will get this information sheet sent alongside their Well Women letter when you get their results. So that's all I have for today.